Through innovation, academic excellence, and family-centered clinical care, Children's Mercy Kansas City is transforming outcomes for children around the world. Welcome to the audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
Our topic today is 22q Deletion Syndrome, a multidisciplinary approach to individualized care. My guest is Dr. Max Feldt. Dr. Feldt is the Director of Children's Mercy Endocrine Clinical Services and Outreach Program and Assistant Professor of Pediatrics at the University of Missouri, Kansas City. Dr. Feldt, welcome to the show.
Thank you for having me.
Tell us about the 22q Deletion Syndrome and more specifically, why Children's Mercy felt the need to start the Super Q Express Clinic.
Certainly. Well, this is something that has been around for many, many years, but it's gone by many different names. It's only been more recently that we've understand the genetics, where it is a section on the 22nd chromosome that is actually missing, and there is a gene on that then leads to a lot of different kind of syndromes, things that happen oftentimes in the midline. So we can see things involving the heart, the lungs. In terms of lips and the palate, there can be some clefting. In terms of hormonal issues, there can be lots of issues with calcium, thyroid, and there's just a multitude of concerns that can happen. Actually, there have been multiple studies looking at kind of the phenotype, which can vary from kind of extremely mild to having more than 160 different systems. So that's kind of why it's gone by multiple names within the past, but now that we understand the genetics of it, we understand that it's all kind of linked to this. Why we here felt that it was necessary to kind of start this is because these children are very, invested in the medical system. They see multiple doctors. They oftentimes have to come in for multiple visits throughout the week, throughout the months. And we really kind of looked back and saw that a lot of these families were just having trouble being able to meet the needs of what was, needed in terms of going to these visits. They were having a lot of missed appointments or cancellations or rescheduling. And so we really saw that there was a need to try to have one central resource for them so that we could help out in terms of scheduling appointments, getting them there, and then when they come to the appointment, they can see multiple providers at the same time, which then, of course, saves them the time that they would have.
Yeah. So when you think back to the what this actually is, a deletion of a gene, mm-hmm. Is it normal to see so many different potential phenotypes from a gene deletion like this? You would think that a deletion of a gene would be more narrow in how it presents, but this sounds like it's hormonal. It could be cardiovascular. I mean, this is a whole array of things, right?
That's right, and that's actually something that we're still trying to kind of figure out. There has been quite a bit of literature out there looking at the specific deletion in that region and whether or not it actually links well to the phenotype. And unfortunately, that's not really the case. So we don't understand a lot of the mechanism that gives us such a spectrum. This is something that we've known about for quite some time, and we felt that it occurs probably in about 1 in 4,000 people. However, more recently, new literature shows that this actually may be occurring very, very frequently, maybe even up to like 1 in 800 people. So this phenotype here may be very, very mild, where people may not realize that they actually have this. Or it's been thought that maybe some of their other symptoms may be due to something else, when in reality it may actually be due to this issue.
So what impact has the clinic had on patients and their families?
So we've been going now for about 3 years, and what it allows us to do is to basically help these families navigate the system, to coordinate care, to provide a visit, which is basically a half day, where we can allow them to be able to see 6 providers at the same time. That may cut down on 6 separate visits, 6 separate times they have to take off work. It also allows for them to be able to have access to services that may take them months to have to kind of navigate into. And the families have told me that in terms of not only saving time, but in just getting access to resources, that's been, kind of life-saving in terms of just getting the care that needs, for them. And it's also important that it's not only that we're looking at the child themselves, but we're looking at the family. Oftentimes these families are dealing with lots of other social constraints, and we're able to have them meet with a social worker during that visit too. And that really helps in terms of making sure that the child can see the providers, but also navigate the system and make sure that they get the care that they need.
So, I mean, I guess when you think about, so you mentioned on average, without your clinic, they would have to have 6 separate visits. So I can imagine right off the bat, Dr. Feldt, that the greatest impact is simply probably on patient compliance and showing up for all of these doctor visits. You know what I'd like to do with it? Children's Mercy has so many different specialty clinics, and many of them kind of take on this multidisciplinary approach. I kind of like for the audience to hear what a typical visit might be for the patient and family. So kind of walk us through that. Who do they see first? How long do these visits last? And just tell us what you think, what kind of feedback do you get from the families?
Sure. Well, so we do these once per month. It's on the first Wednesday of the month, and we have the patients come in. We have a session in the morning and then a session in the afternoon starting around 12:30. And we let the families know that it's going to be a long day. There's going to be many things happening. They're going to be able to see multiple providers, and that way they're kind of prepared for that. That way, if they need to bring any things to basically help them out in terms of the timing. They meet with our nursing staff first to find out if there's any specific issues. We kind of do a review of systems, and then we can kind of gather some of the information to kind of help facilitate the visit for the day. What we like to do, and at least the model that we're currently doing here for the past 3 years, is that we basically have the family stay in one central location, and then the providers come to them. We feel that that's a nice model for the family, so that way they're not having to, transfer from room to room, take all of their stuff with you. And so we basically have time set aside for each of the providers to be able to go in, speak with the family, do the exam, kind of do the medical assessment, and then basically then the next one can kind of cycle in. We have social work that is part of that process, so that way they can assess whether or not there's any specific concerns. And then basically at the end of the visit, we basically have a process where we print out all the things that were discussed during the visit. We really feel that we want to make sure that the parents have something that they can take home with them. Kind of the theme of it is a train, and so we have a train kind of handout for them, so that way each of the times that somebody comes in, they can write down specific things that were mentioned during that visit. If the parents have questions, they can fill it out there. We really want to make sure that they have information so that when they go home, they can refer, and then if they have any additional questions to it, they can let us know. What we also like to do during the day is after we've seen the patient for the half day, then all the providers meet typically at lunch, and we discuss each of them so that way we can make sure that if there's any type of concern that may impact, say, a hormonal system or the cardiac system or the immune system, we can compare, and then that way we can plan for the future.
By the way, Dr. Feldt, I found it really interesting when you said that. So the patients and they stay in one room, and when I hear
Correct.
that, and the doctors come to them, but when I hear that, I'm like, what a great system, right? Why haven't we thought of that a long time ago, right? I think that's a great way to do this, and it probably decreases a lot of stress. How do the families feel about this?
So far the families love it. What they like is that it's really it's really focused for them. They feel like that we are providing a wonderful service that can look not only at one specific issue, but look at the entire kind of medical history, the patient as a a whole, as well as look at the family. What I think that sometimes happens when you're seeing them separately is that you're only really focusing on that one thing. Does the child have a calcium issue or a thyroid issue? But in reality, we need to be looking at the whole patient. And I've had many, many family members tell me that they really feel that we look at them as a whole, and that they felt that we were having more discussions between providers and making a medical decision that was really based upon the entire story. And so parents have been very, very thrilled with that, as well as the providers. I have to tell you that one of the things that I've also gotten back in terms of feedback is from the physicians themselves, and they've told me that they are learning so much more from the people that they work with, and that can really help them in terms of being able to care for these children.
So we're talking about the Super Q Express 22Q Clinic. Dr. Feldt, is this becoming a model for other medical centers throughout the country?
I hope so, yes. One of the things that I think we do a little bit differently than some other centers is that we're not looking for the short term. There are some other centers that really are primarily focusing on the surgical concerns if they have cardiac or a cleft lip, and oftentimes those things get corrected within a few years of life. My focus is really for the long term. My focus is to make sure that we can provide continued care for this patient from the moment that we see them until we can help them to move on, and then make sure that they can get the necessary care for when, they turn, we actually see them up to age 21. So we want to make sure that we have that continued process, and I hope that is a model that can help out.
Right. That's great. Dr. Feldt, I want to thank you for the work that you're doing. It really does sound like a very unique approach, and thanks for coming on the show. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Michael Smith. Thanks for listening.